treatment or management of chronic renal failure. Most of the times this chronic renal failure cannot be treated fully, and the predisposing factors, if we can find out, we can increase the lifespan of the patient. There are a few things which we need to keep in memory. The main aim for the management of chronic renal failure is to reverse or arrest the process of causing the renal damage. Most of the times it is rarely possible. Once we know what is the reason for the chronic renal damage, then we can arrest the process. Avoid the conditions that worsen the renal failure. The symptoms can be relieved, and implement the regular dialysis or transplant at the appropriate time. So these are the major ways by which the management of chronic renal failure is done. Number one, reverse or arrest the process of causing renal damage. Most of the time it is not possible. Avoid conditions that worsen the renal failure, relief of the symptoms, and implement regular dialysis or transplant at appropriate time. When you want to reverse, early detection can help in this process. There are a few examples for it. For example, if there is post-renal obstructive lesion because of ureter stones or because of tumor, if there is lesion, the tumor can be taken out by doing surgery. It can be removed by surgery. Glomerulonephritis, use the immunosuppressants or steroids so that to some extent it can be relieved. Drug-induced, if there is any drug-induced conditions, it can be reversed by avoiding the offending drug. Say for example, NSAIDs are used. NSAIDs can cause renal vasoconstriction. So avoid the offending drug so that it can be reversed to some extent. In the management of chronic renal failure, it is always important to avoid the conditions that worsen the renal failure. What are the conditions which should be avoided which worsen the renal failure? Number one, it is the nephrotoxic drugs. Not only the nephrotoxic drugs, the nephrotoxins, that is uremic toxins, which are formed, including the organic acids. The obstruction, especially in prostate, in male, if there is any prostatic hypertrophy or the stones in the urinary tract, so this obstruction can be relieved to avoid worsening the renal failure. Hypertension or hypotension need to be treated to avoid worsening the renal failure. And there is reduced renal blood flow. So blood flow to kidney can be improved by arterial renal vasodilatation. Renal artery disease should be taken care of. Either there should be arterial vasodilatation which supplies the artery, which supplies to the glomerulus, can be dilated, or the arteries which are coming out of the glomerulus need to be constricted so that the glomerular filtration rate can be improved.